Hi, my name is Dr. Arnold. I'm a dentist, and in this video, I want to talk about the different roles you can have within dentistry. And this is something that many aspiring dentists don't really know about, that there are many different members that make up dental care professionals, not just the dentist, not just the nurses, not just the reception staff. There are other roles that you can have within dentistry. And this can be important, particularly at interview, when you are trying to show that you're aware and you understand the different roles that can be found in the dental practice. Or it might be that you asked a question like, why have you chosen to be a dentist and not a dental therapist? Would you be able to answer that question? Well, to answer that question, you'd have to know the roles that a dental therapist can have and the roles that a dentist can exclusively have outside of being a dental therapist. So can you answer these sorts of questions? And if not, hopefully this video will help you to start to understand this better. And I'll put a link to a document that really goes through the different roles and responsibilities of each member of the dental team. So let's think about some of the roles, positions that are found within dentistry. You can have the dental nurse, you can have a dental therapist, you can have a dental hygienist, you can have an orthodontic therapist. You've got the dentist themselves, you've got clinical dental technicians. Did you even know that dental technicians are a big part of making dentistry really work? All these different roles that you should start to learn about and be confident and comfortable speaking on. So I want to look at some of the differences between a dental therapist and a dentist. So let's read what is said about a dental therapist. So they're registered dental professionals, and as a dental therapist, you can undertake the following if you're trained, competent, and indemnified. So trained, competent, and indemnified is important. Trained, did you go to dental school and get trained in the procedures that we're just about to list here? Are you competent? Are you at a place where you're confident carrying out this treatment? And are you indemnified? So are you insured? Have you got a organization that you're insured by, so that if ever you needed legal help in any situation, maybe something happened, an accident happened, are you indemnified? Are you insured for that to be handled? So you've got to be trained, indemnified, and competent. So for a dental therapist, they're able to obtain detailed dental history, so they can talk to patients, find out their dental history, evaluate their medical history as well. They can complete periodontal examinations and charting and use indices to screen and monitor periodontal disease. So they're able to get involved in the management of gum disease and then the treatment of gum disease. They can prescribe radiographs, so they can start to take x-rays. They're able to plan the delivery of care for patients. So they're able to now oversee care for patients. They can undertake supragingival and subgingival scaling, root surface debridement using manual and powered instruments. So they're able to carry out treatments that help to improve gum health. They're able to start doing that. They can give patients advice on how to stop smoking. They can take x-rays. They can give infiltration in inferior dental block analgesia. So dental therapists are able to give injections, local anesthetic, to numb patients before treatment is carried out. They're able to place temporary dressings and re-cement crowns with temporary cement. So they're able to start putting temporary fillings, temporary dressings on teeth. They're able to take impressions, so they can take the molds if maybe, let's say, whitening trays are needed or other devices are needed for patients. They're able to carry out direct restorations on primary and secondary teeth, carry out pulpotomies on primary teeth and extract primary teeth. So dental therapists can start to do certain treatments on children's teeth, whether that's carrying out simple fillings, or maybe even placing certain crowns to protect certain baby teeth. Dental therapists can start to do that. They can carry out oral cancer screening. keep full, accurate, and contemporaneous patient records. So they're able to be taking legal notes that can then be used to form part of the patient's dental history. So a lot that dental therapists can do. They're able to have additional skills, carrying out tooth whitening, administering inhalation sedation, and removing sutures after a wound has been checked by a dentist. So these are additional skills that dental therapists can have, and dental therapists play a big part within dentistry. So we look at the roles of a dentist, and that starts to show you what then makes the difference from being a dentist as opposed to a dental therapist. So for dentists, they can carry out all the treatments that a dental therapist can do, that a dental hygienist can do. They can carry out all of these treatments. So dentists can diagnose disease, prepare comprehensive treatment plans, prescribe and provide endodontic treatment on adult teeth. So they're able to start performing root canal treatments on adult teeth, whereas dental therapists wouldn't be able to do root canal treatments on adult teeth. Prescribe and provide fixed orthodontic treatment. So a dentist can prescribe and then actually place fixed metal braces on patients, whereas a dental therapist wouldn't be able to prescribe and then place this on patients. But you've also got orthodontic therapists who can start to take part within orthodontic treatments. Dentists can carry out oral surgery or carry out periodontal surgery. So when you start to get surgical now, dental therapists can't do this, whereas dentists can. Dentists can extract permanent teeth, whereas dental therapists can extract baby teeth. Dentists can provide crowns and bridges. So dental therapists can provide certain crowns for children's teeth, for baby teeth, but they can't provide crowns for adult teeth or bridges for adults. So there are additional skills which dentists also provide that dental therapists wouldn't be able to provide. So some of these include injectables, facial aesthetics. Dentists can get trained to start providing implants. Again, this is something that a dental therapist wouldn't be able to do. So you can start to see the differences between the roles of a dentist and a dental therapist. But again, all of these roles that are there work together very well to make sure that patients receive high quality care. So make sure you do know the differences between some of these roles, and just knowing that there are these roles present within dentistry. I hope you found that useful, and I'll see you at the next video.